And I have to, again, I have to just thank you for that. There's so much more work we need to do. Just want to make one final comment with regards to some of the issues that Mr. Daly had mentioned. I am really heartened that we are having a very strong bipartisan reaction to what we're learning here today. In fact, Assemblymember Daly and I were having a conversation the other day about the different experiences that we see when it comes to our different districts. And I can tell you from my district for now about a half a dozen years, what you have heard is very, very representative of the experiences that we've read about in the New York Times and that you've heard about today from this one worker. And I think there are many important policy solutions that we need to think about and consider in the coming months and years. Certainly language access is an issue. Certainly lack of education is an issue. Certainly figuring out a more proactive enforcement of our rules as opposed to an investigation-driven labor and employment regime that we have would be important. It's my perspective that the Department of Industrial Relations does not have enough staffing to either provide culturally competent language access services or to provide that more proactive enforcement. Yeah. And I do hope that we can continue this conversation in the coming months and the best way for us to structure this so that we are both sensitive to what folks do not know, both business owners and workers, but also move people into safety, into making sure our workers are being paid fairly and ensuring that everyone is obeying the law. So really appreciate your reaction and look forward to working with all of us on this.
I want to add one. I have to run to, and I'm sorry. This has been a great hearing. You know, the businesses that are trying to do it right are in competition with businesses that are not doing it right. So I've had to bid jobs against companies that weren't doing it right, and you can't be competitive when you are cheating or somebody else is cheating. So anyway, I look forward to many more conversations, and hopefully we can do the right thing, like Mr. Dodd said. I think more likely we need to educate, and there's plenty of laws. I'm not advocating that we need more laws against business owners. We need to work together with the workers and good businesses to make the field level, and we definitely need to make sure that if people are being employed, that they are paid correctly and they get their rights, the things that they are owed to them.
Yes.
And just 30 additional seconds responding to that in part. In San Francisco, what we decided to do was establish a program to recognize healthy nail salons. So we set minimum standards, and it was essentially a carrot incentive program. We told businesses, if you use healthy products, if you have healthy practices vis-a-vis your workers, and I think we may want to consider an expansion of that to include healthy labor practices, you will get a good housekeeping seal of approval from, in this case, local government, so that consumers will know which nail salons are doing the right thing. That is a program that exists in a half a dozen jurisdictions, but it does not exist statewide. It may require a little bit more legislation to do, but that being said, I do hope we can have that conversation and how we think about it.
So I want to thank the panelists. We got to move on. We're way over on our second panel, which to deal with the exact stuff that Assemblymember Chu has been working on for so long, and that's the health and safety in nail salons as well. So if we can get the second group, which includes Christy Underwood, Julia Lau, Bridget Sharp, and Tui Ha. Ms. Underwood, if you'd like to just begin, that would be great.
Thank you all. My name is Christy Underwood. I'm the Executive Officer with the California State Board of Barbering and Cosmetology. So we have the task of licensing all of the manicurists and cosmetologists and then some. We do have, as has been mentioned previously several times, right now we have over 307,000 cosmetologists, which can, of course, do hair and nails. And we have 127,000 manicurists with 52,000 establishments statewide. So our licensing doesn't differentiate at establishments as to who does nails and who does hair. We just license the business, so basically the business owner. We've been very proactive on a lot of these issues that have been talked about today. One of our main focuses is language access. We've been working with the collaborative for several years and been happy to recently reconnect with them and kind of talk more about what we could do. We've translated almost all of our information into Vietnamese and Spanish and Korean. We do give those, use those languages for our tests as well. And we're continuing. We still have more information that we need to translate, which we're still working on. For instance, communication back and forth with our licensees. So if we receive an application and it's deficient, we're looking to translate those letters as well. We did actually take a recommendation from the collaborative during our sunset hearing that brought up the idea that why not translate everything that you send to a manicurist in Vietnamese, because the population of Vietnamese manicurists is so high. So we have started that as well. We now issue all of our citations in Vietnamese and in English, so it's in both languages. We're looking to translate right now. We're doing all of our appeal information and then as well as our exam information, because we have just as many issues as the individuals coming in from school to take their tests. We, as mentioned earlier by Assemblymember Bonilla, we had some great topics come out of our sunset review that we are working on, like the Health and Safety Advisory Committee that will look further into some of these issues that we could work on. A protocol for our inspectors. We do have 23 inspectors throughout California that inspect the salons for health and safety violations. Our jurisdiction is a little different. We're consumer safety, so we're looking at the cleanliness of the salon, the types of disinfectants that are being used and if they're being used properly. So we do have inspectors that go out on complaint-based as well as routine. We're also looking at pass rates for our examinations. It's a big issue with our language access. We have lower pass rates in our Spanish, so we're looking at that as well and trying to determine what we could do to get those pass rates up. So we're hoping to continue our work with the collaborative. We've also reached out to Senator Nguyen's office because she has such the district of high Vietnamese population, and we've done several speaking engagements in the past in trying to reach some of the workers. Some of the things that we've heard here today is that a lot of workers feel retaliation is possible. And so we are really working with our staff and our inspectors to improve that. We do not want anybody to have a fear of retaliation. We want them to come to us and talk to us while we're in the salon. And last, real quick, we are working on a health and safety curriculum that is to be taught in all schools, and that curriculum is for worker safety. It's not necessarily for the health and safety of our consumers. So it's something that's been in dire need of updating. The board's responsible for that. We're hoping to make it more of a web-based application that the schools can use and more visual so that it's easier to understand. A lot of the industry is very hands-on as opposed to reading something in a book. So that's something that we're working on, and hopefully we'll be done with that soon for improvements.
Great, thank you. Julia Lau?
Hi, good afternoon, Madam Chair and select Assembly members and senators. My name is Julia Liao. I'm the Planning and Development Director at Asian Health Services and the co-founder of the California Healthy Nail Salon Collaborative. Asian Health Services actually was the first to note the epidemic of health issues that nail salon workers faced. And in response, we established the California Healthy Nail Salon Collaborative. We're a community health center that provides healthcare services to underserved communities in 12 Asian languages. And, we knew firsthand from our own experience to see what type of health issues that nail salon workers faced. And this is an issue that disproportionately affects women of color in the workplace. And so we've worked over a decade with the collaborative in addressing health and safety issues, and we've heard hundreds of stories around their plight. And so I'm just going to highlight a few of the research studies that really document what are some of the observations that we as public health workers have seen in the field. Already mentioned, a lot of nail salon products contain the toxic trio. Again, known carcinogens. These are reproductive toxicants. And, the industry will tout that only small amounts will not impact health. But we have to remember that the workers are handling these products day in and day out, 10 to 12 hours a day, 6 to 7 days a week. And so we know that their cumulative and prolonged exposures are really impacting their health. So there are recent studies that have documented these health impacts. Demonstrating acute health symptoms from skin irritations to respiratory illnesses to headaches, neurocognitive conditions, reproductive problems, and concerns. So these studies have really demonstrated the majority of these workers experience these symptoms after entering the industry. There's been a very recent study on reproductive health impacts. It shows that there's an increased risk of what's called small gestational age and placenta previa. These are maternal health complications, pregnancy complications, particularly in Vietnamese manicurists and cosmetologists when compared to other working women. This recent study substantiates that previous studies have also found an association between performing nail care services and adverse reproductive outcomes, such as low birth weight and also major infant malformations. So we know that there are deep issues that exist in protecting this workforce. But there also are effective approaches out there. And as Assemblymember Chu, under his great leadership, passed the Healthy Nail Salon Recognition Program. And I want to point out that this was actually a solution that the community, we worked with the community in, forming, because this is actually an incentive-based approach. So this was rather than a punitive approach. So I think, as Senator Nguyen has pointed out, the community, because of the culture and the language, they were very fearful of also change within health and safety practices. So I think that there's a lot to say with the Healthy Nail Salon program in that it's really expanded, again, to the 5 counties and cities throughout California. This is a great model. In fact, that there was an EPA study that was conducted by the San Francisco Department of Environment as well as the Cancer Prevention Institute of California. And these results are suggesting that the Healthy Nail Salon program has reduced levels of toluene and total volatile organic compounds, and also increased knowledge regarding healthy workplace practices. We actually recently conducted a survey with healthy nail salon owners that have also demonstrated very positive results. 77% of healthy nail salon owners had an increase in new customers. Over half noted that they felt healthier and that their air quality was better. So, kind of in summary, we know that in our county, this is a poster here, that we have 22 out of 58 counties that have over 100 nail salons in their jurisdiction. And currently there are just 5 that have healthy nail salon programs. So we really feel that California can be a leader in the nation to its approach in protecting nail salon worker health and safety. And so we really recommend a 2-pronged strategy. So I think one that was mentioned was expansion of the statewide healthy nail salon program. The opportunity to build on this model is really ripe because it's already been implemented. Educational materials are already translated. They're already established. And criteria has already been worked out from the San Francisco Department of Environment. And workers are really in need of on-the-ground solutions, something that has immediate impact. The second thing is that we recommend more of the long-term strategy is really to lay the groundwork for more safer nail salon products. And so we would recommend not only the labeling of professional cosmetic products, but also that nail products be prioritized in the Department of Toxic Substance Control safer consumer products. So this could really start the groundwork towards more safer alternatives. And I did actually want to make just one really quick comment around sort of the labor piece. And I just want to recognize that also consumers play a key role as stakeholders in the margin of profit because there is a demand for very, very affordable luxuries. So I think we also have to consider that in the education to our consumers. And we are also starting on a labor educational initiative, I think as mentioned earlier, with Department of Labor, DLSE, because many owners and workers do not know their rights. They don't know the standards. So I think the opportunity, again, is also ripe to be able to really provide some resources to those efforts. So thank you for your time, and we really thank you in advance for protecting the nail salon workforce.
Thank you. And on that note, I thought one of the best pieces in the New York Times was this reminder that if you're paying, in my community, for example, $11.50 for a full set of nails, there's no way somebody is making minimum wage and being able to charge that because they would be losing money. So it's a good reminder that we need to be cognizant as clients as well. Bridget Sharp.
Thank you very much, Madam Chairwoman, and the Assembly members and senators in the room. Thank you for allowing us, or me, to be here today. My name is Bridget Sharp, and I'm the Government Affairs Manager for the Professional Beauty Association. And on behalf of the association, I'd just like to thank you all. We're very excited to be a part of this hearing, and we hope to serve as a resource and assist with addressing these important issues that groups like the California Healthy Nail Salon Collaborative have been championing for over 10 years. We are the largest organization representing licensed beauty professionals that work in salons throughout the U.S. Our core purpose is to advance the professional beauty industry, and our first priority is to bring our members the resources needed to help them achieve success in their careers. As a member of our government affairs team, my job is to advocate for the rights of all of our members, and we consistently advocate for higher health and safety standards and upholding the professionalism of our industry by continued state regulation of occupational licensing. And I've provided each of you, with a California state portrait of the salon industry for your review. Our association and our entire membership, we were obviously very appalled upon reading the expose in the New York Times pieces. We really represent the law-abiding, fair wage-paying salon and spa owners across the country who are dedicated to upholding the professionalism of our industry. We've actively worked with manufacturers to ensure products are safe for use and improve working conditions as well in salons across the U.S. for over 25 years. Our association recently proudly supported New York Senate Bill 5966, which was introduced to address the alarming concerns of the expose piece. We were very happy to support the needs of the workers being addressed, the bad business owners being shut down, and the good business owners staying open who are already providing a fair wage to their employees. And also providing ventilation and safe working conditions as well. We plan to support similar legislation in other states, and we've provided you in your packet with our official response to that expose as well. PBA, we house a comprehensive list of resources for the salon and spa owners, nail technicians, and consumers, including the following titles: what to look out for in a nail salon, UV gel manicures, proper removal for continued nail health, protecting the health and safety of nail salon workers, an EPA guide, nail salon workers, health and safety, working conditions, compensation, and demographics, and guidelines for controlling and minimizing skin exposure to nail products. Our full list of resources is at probeauty.org/NMC and includes versions in many languages, including Spanish, Korean, and Vietnamese. I've printed 2 copies of our NMC resource guide, and I would be happy to mail a copy to any of the Assembly members or senators if you do wish. I'd just like to thank you all again for your time and for inviting us here and to be a part of this important panel. Happy to answer any questions or provide resources, and happy to be here on behalf of the workers and salon owners.